The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
Could happen to you. We've all probably done this at least once in our lives. You hop in a car, maybe you're busy, you're on the phone, and you forget to buckle up. This is a 25-year-old who was thrown from a vehicle in a horrible car crash after not wearing her seatbelt. This obviously required many, many hours of surgery to reconstruct her injuries, Dr. Worden. I have to say, her eye was found near her nasal cavity. That is such a severe injury.
On that right side. You know, doing facial fractures for 37 years now, I think this is the worst facial crunch in somebody who's survived that I've ever seen. 22 bones in the face and the skull. I think all or part of all of those bones in this image have been fractured. I mean, this open skull fracture, you can see that the orbit on the right totally destroyed. I think that's the eye that she ended up losing. And they did a magnificent job on putting this back together.
Yeah, you see this image, and you see the image of what these docs did.
And that's how we do it with what we call the microplating system. So all those plates, screws, that represents where they put these in to reconstruct those bones. You know, the bones are there for a reason. They're protecting some real important real estate, i.e. your brain, your eyes, your teeth, your oral cavity.
What happened? Well, this woman claims a microblading procedure did this to her brows. She wants to warn others before they have it done. I don't blame her.
Right.
That doesn't look good. It looks painful. What's going on here?
So what's going on here is microblading is a hot new cosmetic tattoo that people are having where little fine feather-like nicks are made in the skin and then tattoo ink is applied, and it's meant to fill in those gaps in your brows. Obviously, this is not what anyone goes in wanting to get done. In this case, I think what happened is she actually had two problems. One is that when you create nicks in the skin, it's a great doorway for bacteria. And if someone didn't use sterile instruments or there was dirt in the environment, her skin wasn't cleaned properly, she could definitely have gotten an infection or bacteria in here. And then the second is I actually think she, by very bad luck, is also allergic to the dye that was used. So one tip I always give my patients if they're considering any type of tattoo, but certainly a cosmetic tattoo on the face, is try not to do it if you're allergic to hair dye or any other type of tattoo you've had. This can be a very effective treatment to have in trained hands, but make sure you're seeing someone in a licensed environment. There are training courses for microblading now. They're done by the American Academy of Micropigmentation. So please ask your practitioner about whether they have any certification or training to have this done, as you should be doing for any procedure, especially something on the face. And then look at the environment. Are they wearing clean gloves? Are they opening sterilized instruments before they start working on you? Are they using instruments that look clean, fresh needles, all of that? Please be aware, because especially with popular cosmetic procedures like this, they're coming up in medical spas, but they're also coming up in a lot of fly-by-night environments. I saw one ad on Craigslist for something like this that just made me cringe.
That's not where you find your microblader. But as a rule of thumb, I mean, anytime you're breaking the skin, whether it's a pedicure, manicure, whether microblading, whatever, there is a risk of infection. That's why it's so important. Know who's doing it, know the instruments, know the environment, do it the right way.
Know that there can be a bigger price to beauty than just to your wallet. Anyone in the audience have any idea of what this is? Anyone?
Am I allowed to play?
No.
Believe it or not, these are plantar warts.
Wow.
Severe case of plantar warts. I will say there's some good news. After 3 months of treatment, including aggressive debulking, because that is a big burden, as well as topical antivirals, these lesions gradually disappeared, and the result is wonderful. But those are not just plantar warts. Those are plantar warts.
Those are.
So as we all know, warts are caused by strains of papillomavirus, HPV. And in this case, as you may know, papillomavirus loves a moist, warm environment. So if you have like little cuts or scrapes in your feet, the virus just burrows right in. And these can be really painful, actually. It can feel like you're walking on rocks. And so that's one of the real reasons people come for treatment.
And the thickest skin of the body, right? So these have a tendency to be quite deep.
Correct, yeah.
And can get
huge like this, making it very difficult.
Let's show an image
I
of what
remember you
more.
self-treating some of these that you had.
Well, and HPV is ubiquitous, and there are many different types of the virus. So this is a very different form, for instance, than what may cause infections in the genital area.
Yeah, so
but
there are
potentially the same. But
many strains of HPV. These ones are often caused by strain 1, just by chance, because dermatology boards actually ask you that question. But this case in particular had a person whose immune system was suppressed. Right. So the typical person who gets a plantar wart is going to get kind of a demarcated, sort of crusty, firm. This is a perfect one. Sometimes you'll even see little black dots, which are actually the blood vessels. You can actually see them really nicely in this one that feed that virus.
So this started as a spider bite. The bite quickly continued to inflame and swell. The patient, who happens to work here at our show, did ultimately go to the doctor. She was diagnosed with a secondary cellulitis, potentially serious bacterial skin infection. And this is actually one of our producers, and Dr. Batra, you got involved in the case.
I did. So this is like a really good example of, again, when you have a little cut or an opening in the skin, your skin's function as an organ is to keep the outside world out. So now you have a doorway for all these nasty bacteria, viruses, fungus that can get in. So the bite was the portal of entry, and then she, by very bad luck, acquired a secondary staph infection. So she was sort of texting me in real time, and first you see kind of the redness and the inflammation that's a typical bite, but the signs of a true cellulitis are when you start to have expanding redness, warmth, increasing pain as days go on. It feels hot and angry. You might feel sick. One thing that the producer did that was amazing and really smart, you can see she used the red Sharpie, and she was actually tracking the progression. So when she sent me that first text, and then you could see the next day that it was actually expanding outside the pen, then that was obviously not a good thing.